Well, then that may actually be what you're pondering is, why am I struggling with these things? Well, it may be because you're high all the time.
You're high all the time.
Just saying. This is Shrinks and Giggles, your no BS guide to navigating the pitfalls of modern mental health.
From AI therapy to self-diagnosis spirals, we're here to cut through the pop psych noise from your feed.
I'm Melissa.
And I'm Michaela, your psychologist BFFs.
Let's dive in. Welcome back to another episode of Shrinks and Giggles.
Woo woo.
I'm Melissa.
I'm Michaela.
Today, yes, we're talking about finding answers
via assessment.
Right. So we are saying, if you are wondering about your mental health, an approach you can take is to get an assessment. Assessment is to provide answers. That's what the reason a person comes in for an assessment is. However, what the actual content of assessment looks like, well, we'll talk about that in a bit. I will say in a broad-based way, an assessment process is, intended to look at how somebody is functioning. So it's not your stereotypical therapy session, just so we're clear. Because we do have people who call our office routinely who are like, maybe I want an assessment. And often they don't recognize that what we're talking about there is that they are going to essentially take the real version of those cute little tests that we see on social media. Now, you may have found, say, on your social media feed that you were shown a picture of an elephant with an apple inside of it. Or you were shown a bunch of numbers and told that if you could discern which one was not the same color as the others, your IQ was 150.
Yeah. Or the one with you have to trace the ship or something.
One. Oh, I haven't
I
seen
think it's
That's
executive functioning.
It's a planning task straight from a test that I shouldn't reference, I suppose. But yes.
Yeah, we won't name it.
Oh my gosh, that's exciting. Testing is an interesting domain of the world. And obviously, anecdotally, on the people are curious about psychology.
Yeah.
Lots of people, I'm sure, are experimenting with those apps and are wondering, okay, if I take this online IQ test that tells me my IQ is 200, is that accurate?
Yeah. Yeah. Probably not.
Probably not. Just as a sidebar on the geeking out, the ceilings for IQ tests, the most commonly used IQ test, there we go, are the Wechsler scales, and they top out in the 150s. So likely, if your IQ is testing out 200, that means that, that's probably not real. Now, good for them that they've created their own measure.
Yeah.
But there is one IQ test that is better for assessing people who are extraordinarily gifted.
Yeah.
That would be the Stanford Binet. I don't know off the top of my head what the ceiling on that one is. It is higher. But I want to say it's like 180.
180. Yeah, I was thinking it was 182.
Yeah. So any modern day IQ assessments that are commonly used don't actually have a ceiling of 200, just so everybody knows.
Yeah. Just for common knowledge.
Yeah. And me to geek out briefly.
Yes. That's going to happen a lot.
Right. Right.
You can prepare for that.
Yeah. I suppose on that note, to clarify, an average and expected and desirable IQ is 100. That's dead in the middle of a bell curve. That's what we expect most people to walk in with, but we'll talk more about that in a moment. Now, yes, you may have clicked on those. I don't know. I've looked at them and been like, this is really cool marketing. So I will give them that.
Yeah. Definitely makes you curious. I want to do that. Yeah. Let us know if you've clicked on those. Yeah.
Right. Yeah. Now, you may also be an avid, say, Kardashian fan. And so if you follow the Kardashians, you know that at least one of them, and I don't actively follow the Kardashians, so I'm going to mess up which one it is, but at least one of them has been assessed by Dr. Amen in Orange County, who is relatively renowned. Now, his approach to assessment is to do something called a spec scan.
Mm-hmm.
Yeah. And I'm sure we've got a lovely example of what he's going to say about that. But basically, he assesses blood flow and where the blood is going in the brain.
Mm-hmm.
Compared to this one, the front part of your brain is less active than it should be. With your frontal lobes as they work now, it would be harder to manage stress. And that's not good for you, especially as you're studying and you're getting ready to take the boards.
That just can't be.
So he sells lots of supplements, which
yes. Yeah, he's a big supplementer. Yeah.
Yeah. Which is probably how the Kardashians came by him. So, Michaela, do you have one? What's a good pop culture representation of when or how an assessment might be done if we're not going to Dr. Amen?
Well, yeah, we're not going to him.
No.
Yeah, well, Wednesday from the Netflix series Wednesday. Yeah, she has to go see the therapist, and she has to sit there, and she's pretty. I mean, if we don't know who Wednesday Adam is, she's pretty morbid, and she deflects any emotion. She refuses to have any emotions, really.
This is a safe space, Wednesday, a sanctuary where we can discuss anything. What you're thinking, feeling, your views on the world, personal philosophy.
That's easy. I think that this is a waste of time. I see the world as a place that must be endured, and my personal philosophy is kill or be killed.
So, for instance, when someone bullies your brother, your response is to dump piranha in the pool.
You know the old saying, never bring a knife to a sword fight. Unless it's concealed.
Sure.
Yeah.
We can attest to her safety in returning to school.
Yes.
Anyway, okay. Yeah. One of my favorites, which I know is maybe not fully on point, but I will give a nod to it just because it looks a lot like what psychologists may do, except maybe for the electric shock factor, is old school shout out to Ghostbusters when they're looking at whether or not people can mind read. And they are holding up different shapes on cards, and they're not showing it to the person, and they're asking them, what shape am I holding up?
Square.
Good guess, but wrong.
Hey! I'm getting a little tired of this.
You volunteered, didn't you? We're paying you, aren't we?
Yeah, but I didn't know you were going to be giving me electric shocks. What are you trying to prove here anyway?
I'm studying the effect of negative reinforcement on ESP ability.
The effect? I'll tell you what the effect is. It's pissing me off.
Anyway, it's a classic example of old school psychology gone wrong, but it is quite humorous. So,
it's good
we
stuff.
don't engage in any electric shocks in our office.
No.
Yeah, but it is a fun
kind
representation.
Yeah.
And then, of course, there's the ever popular, I mean, I'll just give a direct nod to it and shout out to it. There's the ever popular Rorschach, which I am sure everyone has seen represented in some way, shape, or form in any cartoon, television show, movie, you name it. It's out there.
I'd like to start with a group evaluation. Has anyone heard of a Rorschach test?
The black and white pictures?
That's right. They're inkblots that can reveal how you see the world. I'm going to show you some images and go around the room. Tell me what you see. I'll start with you. What do you see? There are no wrong answers.
I don't know. I guess a tree.
Okay, great. How about now?
I don't know, a fountain?
Good, that's really good. Okay, Ralphie, now it's your turn. What do you see here?
Oh.
I mean, it's an interesting measure. It's a lot of fun for psychologists. Spoiler alert. In grad school, we all sit around often with wine and score the Rorschach together. That is how we are trained.
Give it to your friends.
Right? And then you score their responses while drinking wine. It is amazing. I highly recommend doing that.
Yeah.
But,
Number one reason to go to grad school.
Right. Anyone who wants to be a psychologist, make sure they have have a class on the Rorschach just so you get to do that because it is very
For sure.
enjoyable.
Yeah. It's more forensic settings that enjoy it more.
Right.
Yeah.
It is helpful in, determining if you are criminally insane. Sure, we could go with that.
Sure. Yeah.
Yeah,
Just
that seems fun.
yeah.
Put that right out there.
Yeah.
Yeah. We don't do that kind of assessment.
No.
No. Yeah. I mean, if
Boy.
you're wondering if you're criminally insane, we may not be the right fit for you as a practice, but nonetheless, yeah. Go for it. Why do we want to find labels, Michaela? What are people coming in with?
Our big one is accommodations, right? Like whether that's at school, that's a standardized testing, some way of like I am struggling in school and I need help, or I want to get this job, promotion, and I have to take this test. So yeah, that's a big one. Or the other one is like diagnostic clarity. Like a lot of times, like psychiatrists will send people to us to understand if it's bipolar or ADHD or whatever.
Yeah. No, if there's complexity where you have maybe multiple things going on, or you've been diagnosed with multiple things, or you've been through a variety of different treatments and it hasn't been particularly successful, then finding answers through assessment is a reasonable approach.
Also treatment planning. Okay, yeah. So you come in for an assessment with us because of these reasons, or you just want to learn more about yourself, right? You've been struggling for a while and you just want to know what's going on.
Right. It might be that you're an adult who always was like, I'm a little slow with reading and I don't understand why. Or, you're looking at your kiddo and you're kind of seeing that, they just aren't able to sit down to get their homework done to save their life. And those are all pretty common reasons that someone might come in and be like, hey, what the heck is going on here? Can we figure this out together? And then we are the mental health detectives who do that. Yeah.
Yes, we are. Yes. We love our detective work.
Yeah. Well, so let's talk about the detective work because this is, of course, the best part. Okay. So
you call our office.
That's
You've
true.
You've decided
right.
to get an assessment.
Yeah. So if you need an assessment in California or Florida, obviously you can call us. But if you need an assessment somewhere else, maybe you have to call somebody else. So regardless, you call somebody. Then you set up an appointment. You come in and you're going to sit down and talk about your entire life history. So be mentally prepared for that. Some people are not. I know I even had a feedback or intake session the other day where someone was like, why are you asking me these questions? What does this have to do with whether or not I have ADHD? And I was like, actually, a whole heck of a lot.
Yeah.
So anticipate ahead of time that you are going to be asked about essentially whoever was pregnant with you and their experience bringing you into the world
to now.
Yeah. It's a lot to cover.
Yeah. Yeah. Buckle up. Yeah. No.
Yeah.
We'll guide you. We'll guide you through the conversation. You won't have to just like come and just like spew that out. But yeah.
Right. Yeah. Just as long as you're, aware that you're going to have to talk about those things. Now, you might be like, but why the heck do I need to tell you about, my mother's pregnancy or, that I was premature or that I have trouble tying my shoes. These are all things that we use to try to figure out what the heck is going on.
Yeah.
And we're looking for multiple things to point and align towards a particular answer, towards a particular area of weakness, so that we can then also focus on the strengths.
Yeah.
But we're looking for the data to line up and make a pretty picture for us.
Yeah.
Yeah,
you can roughly expect these sort of meetings when you come in for an intake to last about an hour to an hour and a half, just depending on how complex things are. Ours typically are an hour.
Yes.
And
at the end of an intake, we're going to talk you through whatever process we think makes the most sense for what you're telling us. So we're going to say, hey, okay, it looks like it's going to take about this amount of time for us to administer these tests. We can do this virtually. We can do this in person. Make sure you get a good night's sleep. Don't start or stop any medications without talking to us first. Try not to be hungover. Try not to get high the night before. Just all the basic things, right? Yeah. If you're sick, please don't come, etc.
Yeah, because those things affect the testing.
Right.
They're going to affect our ability to get your baseline, right? We're just looking at your functioning right now. So
yes,
you definitely don't want to be
worse
high.
For wear. Well, that would be worse for wear.
Yeah. I mean, if you're high all the time, I mean, I guess we can chat about that.
Well, then that may actually be what you're pondering is, why am I struggling with these things? Well, it may be because you're high all the time.
You're high all the time.
Just saying. I mean, but hey, if you need us to, evaluate that with you, we can. And, we can figure out together the utility of being high all the time and, what strengths maybe you have when you're high. I mean, we could do that.
Oh, for sure.
I mean, we're capable of that. So, that's
absolutely.
Okay.
Mm-hmm.
Yeah.
But yeah, so then at the end of the intake, we talk a little bit about the, how long testing may take, and that ranges. But I mean, typically you come in for 2 to 3 hours of testing a couple of times. And we look at a number of things.
Yes.
Such as your cognitive profile, right? How do you think about things? How do you problem solve? How do you, I don't know, process information?
Yeah. So the cognitive profile, I also like to think of as, because that is where that IQ testing comes in, is us talking about essentially how readily do you learn different types of information and how readily do you reason with different types of information. And we're looking for patterns within that to help us figure out what, your strengths are, what your weaknesses are, what we can do to build those strengths up. All of those kinds of things. So that spans a wide array of stuff. It can span, right? Like verbal reasoning. We can, be pondering how readily you're able to use language to articulate what you're thinking about, understand language. What else is there?
Visual spatial skills. How well can you analyze and synthesize visual information? How well can you put that luggage into the trunk?
Oh yeah, Tetris. Yes, definitely. Yeah.
And then your fluid reasoning, which is your, pattern recognition, inductive, deductive reasoning, quantitative reasoning, math skills.
Inherently how readily you problem solve.
Yes.
Yeah.
Yes. When you can't really use much language. Yeah.
No, not necessarily. But to differentiate it from Tetris, I would say like the Tetris stuff can be a little bit more about hands-on conceptualization of three-dimensional space and building things and making sense of how to, engage in a three-dimensional world to make things. So Legos, furniture, you name it.
Right. Right.
Yeah.
Do you struggle with putting together IKEA furniture?
Left side panel, box I. Okay, left side panel, box I. Why does it say J?
I love IKEA furniture.
Me too. Yeah. Me too. I know.
Yeah. It's so soothing. Sit down. Yeah, I know. I know. You visited me and put together my bench. You're amazing.
Yep.
Yeah.
Yep. And then I like hyper focused on the Legos.
Oh, right. And then you did a Lego. I forgot about that. Yeah.
Yeah, no. But like, like at 10 p.m. I was like putting together your like bench.
Yes, I know.
I do love a task like that, a visual spatial task.
They're so fun. I find them very therapeutic. I'm with you. Entirely.
No, absolutely.
But then we have my less favorite domains like working memory. Not a huge fan of that one, but that's looking at how readily you're recalling information that was just thrown at you and how readily you're able to do something with that information.
Yeah.
Yeah.
Whether it's auditory or visual,
Yeah.
which
Yeah.
is the nice part of that, I guess, part of the test. It looks at both.
It does, which is nice.
Yeah.
Yeah. Because
Yeah,
often we
sure.
have one way that we feel we're better at remembering information. So it
Right.
gives us that. Yeah.
Yeah.
hmm
Yeah. And then there's processing speed, which my favorite way to say that is how quickly does your engine rev with simple visual tasks? Which is from Melissa.
That's so funny. I'm sitting here like, really? That's for me?
Yeah.
All right, cool. It's one I've maybe put in storage and haven't used recently. But
yeah,
thank
maybe you found a
you.
new one. Yeah.
I don't know. I'll bring it back out, try it on again next feedback session. Like, all right.
Yeah, absolutely. We also look at executive functioning, which covers lots of things, but that's your time management, your organization skills, your planning skills.
Yeah.
There are lots of different tests that cover that, but
Yeah. And that can be helpful for a variety of reasons. And we don't always expect any. Again, there's no specific pattern. We're just looking to make sense and see what pattern arises in your data. And then depending on that, we're trying to make sense of what that may mean for you.
Yeah.
So, executive functioning often considered to be an ADHD realm, but not always. And it frankly often can speak a lot more to some other things that might be going on.
Absolutely. Yeah. There could be a lot of reasons that your executive functioning is struggling. But
Definitely. Yeah.
yeah, but oftentimes, people do come in and they're like, complaining about executive functioning difficulties and thinking that it might be ADHD. So,
Right. No, for example, if you call us and you're like, I just had a baby and I can't figure out how to organize everything, I'm not going to diagnose you nor give you an assessment. I'm going to say, wait until your child is not a baby and then we'll talk.
Yeah. When you're not sleeping and your hormones are all out of whack, I think that
Right.
there's a reason why you're struggling.
Right.
We also look at attention, particularly if you're coming in for ADHD testing.
Sure. But sometimes when you aren't too, if we're picking up on something where we're like, wait,
hence the intake. Yeah.
Yeah, definitely. For sure.
Yeah.
For sure.
And why, when you might call, if you're a private pay client, we have ranges of like how much things cost based on how much testing you have to do.
Right.
And so, you might not get a clear answer because you have to do the intake.
Right.
Because we ask you a lot of questions and a lot of stuff comes up from that. And, I've been in plenty of conversations where someone's like, oh, I wasn't thinking about that, but now I'm thinking about that. This happened and this happened. And
right.
So,
absolutely. Yeah. And we're looking at all the factors. There's also social emotional, assessments that we might do depending on, what you're talking about in terms of your interpersonal experience and what that has looked like and how navigating those spaces.
Absolutely.
I know we get pushback sometimes related to like the mental health components to things, but we certainly, one, have to look at that. But two, it's pretty impactful overall to all the other testing that we're doing. So we need to kind of know and see what that is.
Yeah, absolutely. You need to know where your mental health is falling, because oftentimes, and I do say this, quite a bit, but, if you've gone so long with maybe a neurodevelopmental disorder undiagnosed, oftentimes what brings you in is a mental health diagnosis, right? Like you're starting to experience some discomfort in that area.
Right.
So it is really important to kind of look at that and get some clear history on those things, in addition to obviously data. But we want to look at the way that you think about things in that realm as well. So it is vital, to the eval.
Yeah, absolutely. And then we also look at your memory, particularly for those who are putting themselves in situations where they need to memorize a lot of information. So a lot of our med students, but anybody who's, maybe studying languages or is
Yeah.
in a space where they're really in need of retaining a lot of information, it's
Yeah.
something we will at times look at. And it's broader than working memory because, yeah, it looks at the nuances. It looks at how
Mm.
you're retaining what you hear and what you see and how readily you're doing that immediately and how readily you're doing that later. And if are writing something down, does that help? It looks at all of those kind of nuances.
Yeah.
Mhm.
Yeah. And we also include it for like head injuries, right? If you had multiple
Yes.
concussions or
Yeah.
maybe a disease that affects your brain, or
Right. Yeah.
affects your memory. So,
If you have concerns related to some sort of cognitive decline, you've had a lot
mhm.
of concussions, you've gone through chemotherapy,
Yeah. Yeah.
and you're worried about, how that maybe has impacted you.
Yeah.
Yeah, I mean,
Absolutely.
lots of different nuances to this in terms of the whys and wherefores. And yeah, I mean, the answers there may not be a diagnosis, but rather, hey, this is like where we think you were at because we have some tests that can do that. And here's where you're at now. Yeah.
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 Absolutely. Yeah.
Yeah.
And we also do like to get some collateral sources of information when possible. you know, we do have people
Yeah.
that maybe, you can't, especially as people get older, you might not have your parents even around to report on how you were as a child. Um, but we do try to get as much or your treatment team, if you're working with psychiatrists or another therapist, we like to, you know, use multiple points of information to understand your overall functioning.
When do you get your answers? Once we're done all of that, some things that people don't realize psychologists do. So we don't like, it's not a Scantron sheet. That dates me, I
Mm,
know, but we don't
yeah.
just spit it into, a scoring thing and then it gives us all the answers. So there's a lot of analysis and synthesis of information. Um, you can think of it more like a radiologist having to read
Mm,
multiple different images and trying to connect the dots. So,
yeah.
it takes us a while. So we, usually spend, another few hours over the course of usually a few weeks. Every practice does it a little bit differently, but in ours, that's what it looks like. And
Yeah.
during that time, we're, making sure we've given you every test that we think we need to give. We're asking you more questions. We're, taking all of that information and creating a strengths-based report, creating
Mhm.
something where we're going to sit down at the end of all of this and we're going to talk about all the ways that you're really awesome and what we can do to dial those things up. We're going to help you if you're wondering what kind of career paths maybe, good
Yeah.
options for you. We'll help you figure that out.
Yeah.
We'll, help you navigate how do you go through a process of securing accommodations at work, at your school, at both. Um, will, help you get connected to community resources that you
Mhm.
need, both for, a label that we may be providing, but also, to address any immediate needs that you might have.
Yeah.
And so when you leave, you have a treatment plan, you
Yeah.
have a map to give you steps to take.
Yeah. Absolutely. And we have a team of therapists that you could work with as well too. So there's guidance and I like to tell people I'm not going to send you out into the world with no, assistance. If you run into something, it's a lot to process when you sit down for an hour and I'm telling you all this
Mhm.
information and
Yeah.
so I mean, it's just nice to have someone on your side too that maybe can help you navigate and understand your, complex profile. So I think that is definitely a draw to like working with like a therapist within the testing center that you do, if they offer that, right?
I would vote that a good assessment psychologist leaves themselves open to the opportunity to reconnect with you with any questions that you might have, to help you and meet you as things are evolving, right? So like I will meet with families as they're going through an IEP process if they need some additional feedback, or, you know, go to an IEP meeting, or I will, you know, which for those who don't know is, you know, to help a child get accommodations in their school. And, you know, I will follow up with people if they are overwhelmed by looking at a bunch of numbers that they've never seen before and they, you know, have questions. Or if they are approaching treatment a particular way and they're finding that's not working.
Yeah, absolutely. Yeah, we definitely don't want there to be overwhelm after you get an evaluation. That's like, you know, something that we want people to feel like when you leave with that report that you have, you know, a roadmap and that you also have a support system behind it. Yeah. So.
Yeah, we do this to empower people. And, you know, that's why I was talking about strength. Yeah, we want you to leave the office feeling like, even if you didn't get whatever diagnosis you thought you might get or something like that, that you have some ideas of things that feel accessible for you to do to grow, learn, and provide access to the life that you want.
Period.
So if you're looking for answers, if you're looking for some support, Aspire, you know, can help you with that. Obviously, if you aren't in California or Florida, you may need to look elsewhere. But, you know, an assessment process can give you answers that you may be seeking and can provide you a roadmap moving forward.
Yeah, absolutely. Well, thanks for listening. Like and subscribe. We can't do this without you. We love you guys. Let us know if you've had an assessment process done. If you want us to look at data, don't just send it over the internet.
Reach out
Please
first.
Don't share. Don't send your protected health information via the internet. But yeah, reach out to us. And yeah, let us know your questions. If you have any questions about this, did we answer them? Did it just give you more questions? So let us know. Like we said, we do like to talk about this. So thank you for listening and join us next time.